Excuse me, I'll just repeat again for the housekeeping announcement. For those who have not been able to register in the morning, kindly do so in order for you to get your goodie bags and the program booklet. And please take note that there will be a separation in the venue for tea break later. For the general audience, it will be located at the first floor, while for the VIPs, you will be in a VIP holding room on the ground floor. Thank you for your kind attention.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. And very good afternoon to ladies and gentlemen. I feel very honored today being invited to be one of the speakers in this fifth iMIREX conference, and my gratitude to the organizer, especially Dr. Dato Sri Dr. Hasan. I've been looking forward to address fellow medical emergencies practitioners to explain Malaysian Armed Forces role during natural and non-state disaster and also emergencies. Armed Forces has been portrayed as first responder, backup team, and also as lead agency in this event. But in fact, in real life, our role is none of the above. ATM has been portrayed capable of doing many things. And it is because that we have our own asset and we have our in control of our own asset. And the most important thing is that our logistic support is super, second to none. But however, the pillars of our success in handling all these eventualities is because of our regimental values among our personnel, and which is less prominent in the outside of the military community. As such, we have been called as Jack of all trades. This international conference on major incidents and disaster management, we have been a participant for the last five conferences, and I think this is the first time that I come and willing to share our experience and what we think of these emergencies or what we should do in order to progress our emergency response. As you see in this slide, this is the view of Tacloban town after the typhoon HAIYAN ravaged the area. And as you see, we got the first sight on the second day. We were being called by the Philippine government to assist their people during this disaster, and it was against between the military agreement. Let me explain a bit on this Malaysian Armed Forces. Malaysian Armed Forces is a self-contained war fighting machine. But after we have a peaceful time, during peacetime, we have added additional roles in the military operation other than war and also in the civil military effect. This is for assisting the national building capacity. And we also link to the civilian authorities, official government agencies, and also NGOs. Many of these official government agencies and NGOs help us during the disaster, and they come to us where we help them by providing logistics and also security to them. And they can carry out what is necessary or what is they are supposed to do during that period. Let's go back to my presentation. The scope of my presentation is as shown in the slide. And to know more about the Malaysian Armed Forces, the defense policies of Malaysian Armed Forces is to defend the sovereignty and also the national interest in such a way that Military Health Services Department, our role is to support all the military personnel in order to carry out their duties, that is protecting the sovereignty and also the national interests. We also participate in the HANRO. This is a short form of Pertahanan Menyeluruh. In the Western world, we call it the total defense, where we have the Territorial Army, the National Guard, and also the PAHLAWAN, that is the student military agencies in many of the in the public universities. Initially, post-independence, we have a program called KASMAN, that is Keselamatan and short form for Keselamatan and Pembangunan, or security and also development for the country. We participate in this program, and it has progressed until now what we call, or we can call it as a National Blue Ocean Strategy. National Blue Ocean Strategy is the extension of KASMAN, which we started during our post-independence. While doing our duties or our chores, and we are under the rules and regulation that guide us so that we do not breach the law of the country, of which country that we were sent to. One of the most important things is our Armed Forces Act. Yeah. We are also governed under the Geneva Convention and law of armed conflict. It is when you are in uniform, it's not meant that you can do whatever you like John Wayne do in the films. Okay? We are under the governance of the Geneva Convention and law of armed conflict. We can't do according to what we want, but we are being controlled by this convention in such a way that, in other words, whatever we do is accordance to the rules of the country. And the evolution of the Malaysian Armed Forces during or before the independence, we were busy fighting the communists in the jungles, and we also our program of counter-insurgency warfare before that. But after the independence and after the confrontational between Malaysia and Indonesia, we have progressed into such of, we call it a conventional warfare, where we adopt many of the Western mode of war. Okay. And other important steps that have developed after the Communist Party surrendered in the 70s, that the regional membership has become, it was formalized. And one of them is the ASEAN, we call it ASEAN, the regional stabilizing factor. And Malaysia is one of the proponents of this ASEAN, and I would say that our country is the leaders in this ASEAN grouping. And now this ASEAN grouping become the regional stabilizing factors, and many initiatives have been initiated among this region, and now it has progressed into the adding on another 10 more countries all over the world in order to support the ASEAN initiative. So at this time, our role has expanded into a multi-dimensional, and part of it now, which is popularly known as humanitarian aid and disaster relief capabilities. Amongst the non-traditional security threat in the military operation other than war, we also involved in a peace stabilizing operation, whether it is in this region or at international level under the United Nations, that is a peacekeeping operation, counter-terrorism, maritime security, because Malaysia is a maritime nation, and also assisting if there is any eventuality, like the latest one was in the Arab Springs and in Libya, where we do the non-combatant evacuation operation. And most important is our civil CMA, Civil Military Affairs, and also HAIYAN. During disaster, our roles remain the same as a military organization, that is to support the national interest. So this support, it depends on what is needed during that particular time, and since the logistic support in the military is good, that most of the time you will find that the military personnel will be the first in the scene, whether it is in the local scenario or at the international level. Where do the health services come to play? That is, we were sent to support the main body in assisting the team to provide the disaster relief. And we also participate in the national level, that is the smart high urban SAR with the INSORAC accreditation, where we have nine of our members as the team of the smart team. Many times, I'm sure that you are aware that during disaster, we can have knowledge and experience, but many a times in each disaster, the scenario is as complex as what you see in the cloud. Okay. It is overwhelming, and it's dynamic, and it requires a strong leadership in order to control not only the peoples, but to control our own peoples and the victim as well. And you know that under the duress, this is where the military leadership prevails. And to share a bit on how the military is being deployed, whether in the domestic levels or in the international levels, you see that the association between the NADMA, now the newly formed NADMA under the Prime Minister Office, and the MF is a dotted line. We are not under NADMA, but we assist NADMA. So under the Malaysian Armed Forces, we have 3 services, and these 3 services are the ones who participate in any disaster relief or humanitarian aid, and the medicals is attached to the services. Whereas in the NADMA, they have the organized government agencies and also participation of the NGOs. At international levels, i.e. that is under the ADMM plus, this structure is where we are participating in any disaster to any country of any 10 country of ASEAN. Okay. We are closely related under the Asian Humanitarian Assistance Center in Jakarta and also with ARAD in Bangkok, Thailand. And the structure, how the information or the instruction being delivered is from NADMA, and if it is the Asian nation, then it goes to the AHA or ARAD at Bangkok, then where it contacts the agencies at various ASEAN states. And these are major disasters that we have been participating way back in 1992 at Flores hurricane until to the latest one in Tacloban in 2013. This is all at international level. Things that we have learned from all those programs or on those disaster relief, that many a time when we send for assisting the devastated area, they need many things. One is the immediate basic need for the survivors. Those are like shelter, food, water, communication. And we are attached to that. Yeah. Even though in the local area, in the local scenario, when the time when we reach the disaster area, we brought along the medication. And first thing, the victim will ask, we need food, we need clean water, and we need shelter, we need blanket. And this is what they need most. So we learn from that, and in our team, we don't only bring medication or first aid, but we bring along food along with us. At least that can help, can support them for at least for a day. Okay. We have shared this knowledge and experiences with our fellow teams or fellow agencies, whereas we develop a common SOP, standard operating procedures, where we share our general knowledge and specific knowledge of certain disasters. For example, what we had recently, that we have the exercise Topeng Ganas that was held last month, where we have a multi-agency, local agency to participate in a case of infectious disease outbreak. It was done in Kluang, where Kementerian Kesehatan, veterinary center from Kluang, and also the local government participated in that exercise. For us, among the military, we have scheduled that we train our peoples through the training of tabletop exercises and also a field exercises. So these exercises, we always invent something new so that it will facilitate our assistance that more efficient. Okay? And during the exercise with other government agencies, we share this knowledge so that whenever the time comes when it is needed, we can really know what is needed during that particular time. And at the same time, we also test the NATMA or the MKN Arahan 20, which is on the Arahan 20 is regarding disaster assistance. And so that when the time comes, everybody knows their place and everybody knows their specific duty. At international levels, our interoperability among nations is well established. We participated exercises for HADR in Bangkok. We participated in Brunei. Even we go as far as Russia in order to participate in their ways of providing assistance at the disaster area. So after all those experiences, where do we go from here? Okay. At local level, the first and the most important thing that we have to communicate among the agencies. It doesn't mean that when you are in certain agencies, you have this specialty and you have to keep it within your organization, living in silos. But we take an open approach on this thing because we believe that education and knowledge is meant to be shared. Because the more people capable doing that, you improve the capacities and the capabilities of the nation in order to take on the disaster, whether it is natural or it is made. So once everybody understand how to overcome the disaster, surely that the services or the supporting services can be delivered efficiently. At international level, we participate in the ASEAN Agreement on Disaster and Emergency Response, iMIREX, and we develop standard operating procedures if any organization have ever had this eventuality. So all in all, we have done our part as main agencies to come to be there when we are needed. In summary, in time of peace, we train ourselves, we train in combat, but also now we train ourselves in how to support the government's intention or the government interest in to support the national building program in such a way that we share our knowledge and we share our experiences with fellow agencies, government agencies. And Malaysian Armed Forces has been involved in domestic and international disaster exercises. For example, in this exercise, we participated in a competition, we participated in booths, and there are few emergencies practitioners who participated in academics presentation. We improved the interoperability among us. We fine-tune our standard operating procedures, and we have multilateral agency training program. And I'm sure that in the future, we will have a better understanding in taking on if there is any disaster happen. A bit on this picture. This picture is very nostalgic to us. This is taken during the earthquake at Yogyakarta in 2006, where our team and the local crossed the battlefield to assist the locals in their need. You see, the first two are the local, and followed by 7 of our personnel. And we were there for almost even after the critical period, we also participated in the rebuilding of the area. For that, thank you very much for listening. And have a good day.
Thank you, Lieutenant General Dato Pahlawan Dr. Haji Abdul Razak bin Muhammad Yusoff, the Director General of Health Services from Malaysian Armed Forces. Now, we would like to call upon the stage Dr. TEODORO HERBOSA from Philippines to present the next topic for our conference, which is titled The TWIRL of Nature, Typhoon HAIYAN in Philippines.
Good afternoon, salam sejahtera. I'm very happy to be back here in Malaysia to give you our experience in Typhoon HAIYAN. The program says Hainan. I think that's where the chicken comes from, chicken rice. Maybe the one typing was hungry already, or maybe it was spell check. So, of course, I worked for 5 years. I worked at the Department of Health as Undersecretary or Deputy Minister, of which I was in charge of the disaster. I've also had about 25 years of academic experience. 5 of those years were spent here at the University Kebangsaan Malaysia, the tie I'm wearing. And I now advise a telecom company on health informatics. We advance and have received grants from MSD and Novartis. The guy in blue is Dr. HERBOSA trying to look Malaysian. This was during Hari Raya in 2011, I think. And the students are my graduates in emergency medicine, the first batch of graduates of emergency medicine in University Kebangsaan, Malaysia. A little bit more about me. When I was 12 years old, there was a powerful typhoon international named Patsy. And in the Philippines, the name was Yolin, very similar to the local name. It was also 250 kilometers per hour. I was a 12-year-old boy watching the window as roofs of houses in Central Manila were flying like paper planes. Here comes a shriek from my sister. I discovered that the whole roof of our house had already been blown away by the typhoon. I helped evacuate that room. I carried down a big mirror. You know how the ladies like to have big mirrors in their rooms, so I carried it down the stairs. The surprising thing is after the roof has been fixed, it took 6 people to carry that same mirror up again. So what is the anecdote there? As what Dato Abu Hassan said, society and human behavior is able to achieve superhuman feats when the challenges do arise. And I think this is the story of Typhoon HAIYAN. So I also like, being an academician, I also like to inculcate the need for how to do research and innovation so that we can transform our concepts and be promoted for our policymakers and leaders in the principles of disaster risk reduction. We also need to understand that as disaster people, we need to understand what are the gaps in research and what are the strategies we should be learning from these many experiences we are being challenged with. And what strategies we can use to make research and innovation even better, and how the policies can transform and save lives in disaster risk reduction. So, as I became interested in disaster, the first world global effort to try to decrease disaster reduction was in 1990 to 2000. This was the UN's International Decade for Natural Disaster Reduction. Of course, many of the countries who have many disasters, Japan, Indonesia, Philippines, were all part of all of this. And these efforts, the idea was to reduce the loss of lives and property and restrict socioeconomic damage through concerted international action, especially in developing countries like ours. This was replaced in 2005 actually by the UNISDR. So out of the international decade, we created a UNISDR, International Strategy for Disaster Reduction, that went together and gathered all world experts in disasters. In 2005, that's the first world conference, and that was done in Hyogo after the Kobe earthquake. And it created what is called a framework for action. We enumerated 5 frameworks for action. Disaster risk reduction came up as a first word, and we wanted countries to implement laws or institutionalize their disaster risk reduction. Second, we wanted people to identify their disaster risks. we wanted better knowledge management. This is where the research and creating a culture of safety among communities in the developing world and reducing the underlying risk factors to enhance preparedness for an effective response, even with low resource environments. If you look at this data is from a Center for Research in Epidemiology of Disasters. This was done in 2009. You can see the Philippines is up there in that time. Now it's, I think, still somewhere among the top 4 or top 5. But you can see of all the different types of disasters, whether it's climate, geophysical, hydrological, meteorological, and we count on the numbers. Now, there are other forms of this report in terms of number of affected people, number of deaths, and number of economic losses. And always up there is China, Philippines, India, Indonesia, Japan, all those other countries. So out of that Keroh framework of action, the Philippines decided to change its approach from a presidential order of how to handle disasters to a National Disaster Coordinating Council. We passed in 2009 a law, a Republic Act, that created an act strengthening the Philippine Disaster Risk Reduction and Management System, providing for the National Disaster Risk Reduction and Management Framework, and institutionalizing the National Disaster Risk Reduction and Management Plan, appropriating funds. Prior to this, we could only get funds from the government once a disaster happened. But with this law, what happened was it shifted to risk reduction rather than disaster management or disaster response. And out of the National Disaster Coordinating Council, we evolved to what we now call as the main body of government, the National Disaster Risk Reduction and Management Council. From the national, there are regional, provincial, city, municipal, and barangay disaster council. So it goes all the way down to the lowest level of the community. Now, with that sort of organization, we realized that we needed to actually involve the use of science and technology. One of the nicer projects that's now openly used by many of the Filipinos is available as an application on their cell phone. It's called NOAA. NOAA stands for Nationwide Operational Assessment of Hazards. This was implemented by the Department of Science and Technology, and the idea was to give to the Filipino in his hand the idea of where the hazards are and what the hazards can bring you. So it's a multidisciplinary approach using computer technology. It's a web-based. It's also an app on a phone. And it's able to put together a lot of the stuff that we do, from hydromet sensors, LiDAR mapping, etc. So hazard mapping and warning systems were all inculcated in the Project NOAA, which is what we use based on previous disasters from web geographic information systems, Doppler systems, etc. This is the landing page. If you go to the landing page of Project NOAA, there is also a cell phone app for it, and you can actually look at what's happening in the Philippines today. Especially, we had Typhoon Karen that just passed it. My flight was delayed for 2 hours because of heavy rains in our airport, and you can actually look at the project site, and people use it from anybody, from all agencies, the health department, the military, the media, etc. So it's now become a useful tool. A second one that we've developed over the years of experience with many disasters is a program called SPEED. This was developed by the Department of Health. This was funded by JICA, the Japanese International Cooperation Agency, but it was funded by WHO. This was developed by local IT professionals, a medical doctor, Dr. Ivy Domingo. This is similar to syndromic surveillance. Syndromic surveillance is when all the centers of a particular evacuation area would report to the central office through SMS the most common symptoms seen for the day. Now, the beauty of this in terms of leadership and governance is that I can be ahead of an outbreak or an epidemic by being able to understand what is the type of disease. For example, so it's a reporting system. This just describes the reporting system. But let me describe to you what we've done in experience. For example, if we see on this particular area affected by a disaster, in the evacuation centers, a trend of increase in watery diarrhea, what the Department of Health will do is to send water filtration systems, chlorine tablets, and prevent the outbreak of in gastrointestinal disease or cholera. So this we have done very well. If we start to see a lot of upper respiratory tract infection, we send in our measles vaccination and vaccinate all the children below. So it's a methodology that we've been using since way back. In Typhoon Haiyan, the Japanese teams actually saw this and they decided to report with it. So they were one of the few foreign teams that were reporting to the central. And they copied it, they researched it, and now they developed it into a more elaborate system called J-Speed or I-Speed. Now this is the map of Typhoon Haiyan. The green path is actually the path that was the predicted path. The one below that, the one that is a curvy wave, is the actual path of the typhoon. So this typhoon is unique. It's the strongest ever to hit landfall, over 300. In fact, the measuring systems of the meteorologic agency measures only up to 300 kilometers per hour. So they could not measure really what was the true strength. It was over that. So we now have to develop measuring systems way above that. The second unique thing about it had 7 landfalls. So you can see the different islands of central Philippines. You can see over on the top left of the screen is the whole map of the Philippines. The central part is where it passed from east to west. And it made its first landfall in Samar Island, and then went to Leyte Island, hit part of the north of Cebu Island and Panay Island, and then ended and left the Philippines, leaving the northern group or the Coron group of islands of northern Palawan. So it had 7 landfalls. There were predictions of storm surge. Now the funny thing is that although the storm surges were predicted, up to 1 to 2 meter high storm surges, nobody understood what the storm surge was. Except for Giwan Samar, which is the first landfall, the mayor was told that there would be a tsunami coming. Of course, the report was wrong because tsunamis happen after an earthquake. But because he understood what a tsunami was, he evacuated all his people and there was only one death. A guy who was climbing the hill and eventually suffered a heart attack, but everybody was safe. Tacloban, on the other hand, is always hit by typhoons every year. So they're arrogant. They say, we get hit by typhoons every year, we can handle this. They did not realize how super this particular typhoon was. So just to give you a visual picture, on the right side of the screen is actually Tacloban, how it looked like on aerial photo with the many houses and buildings before the storm surge and the storm passed. And the second one is the after the storm passed. So what's interesting about Typhoon Haiyan? It has 2 things. It has water, a lot of water, the water surge, the storm surge, and it had 300 kilometer per hour winds. So it had strong winds. So it will, if you don't get washed off or drowned, you'll either be injured from flying debris because of the strong typhoon. This is how it looked like on the ground. Totally devastated health centers, even our positioned medicines and supplies, because our regional center was based in Tacloban, in Palo actually, which is the town beside Tacloban. All our pre-positioned supplies that we do in times of disaster to deliver to the people who will be affected were all water damaged because the roofs and the centers were also affected. Well, of course, that's me arriving about the 3rd day after the disaster. Why the 3rd day? Because on the 1st day, there was no communication. The airport was not functioning. By the 2nd day, the president went to the site. Of course, the military sanitized it, so none of my medical teams could enter. The only one that could enter were people that came by boat or land. Because by air, it was blocked because a very, very important person visited it. So that's one lesson you should actually learn, prevent your very important people from going to ground zero when the time what you need are actually medicines, water, and food. So this is another informatics use that we had. So we activated what is called the health cluster in the United Nations approach, or UN OCHA. There is a cluster approach for humanitarian and disaster assistance in the UN system. So you have the health cluster, you have the development, the shelter cluster, and many agencies actually report to that. So we've been using that cluster system was used first after Mayon volcano erupted together with the typhoon. Two disasters in one. That was in 2001 or 2002. And since that time, we have evolved, becoming better and better. The health cluster has been very strong with the partnership with WHO and with UNICEF. So those were the strong partners of the UN agencies with the health sector. And what it does is it organizes anyone that wants to enter through health. So we have two systems. You have either military, as presented by General earlier, or you can enter as a civilian government agency assisting the country. So you enter through us, through the civilian community. So this picture shows you the first time we used again something theoretical in the WHO humanitarian system. We, for the first time, used what was called the FMT classification, foreign medical teams. And I used for the first time this geographic information system wherein we were able to identify needs. And then if you are a team that's coming, a foreign medical team that has been voluntarily approved by our government to assist, you will be deployed to an area that everybody wanted to go to Tacloban because CNN was covering only Tacloban. They didn't realize that there were 7 other sites that needed help. So we in the government made sure that there was no overcrowding in Tacloban. So this area shows you 3 islands, the northern island of Negros, the island of Panay, and the island of Leyte, Cebu and Leyte. This is the one that shows Leyte and Tacloban. And you can see some of our initial reports. I get these reports twice a day, one in the morning and one in the evening. And a foreign medical team type 1 is one with outpatient services. A foreign medical team type 2 has emergency services and some minor surgery. A foreign medical team type 3 has specialized operations and intensive care facility. So in this particular situation, wherein most of Tacloban was devastated, we created field hospitals. The first field hospital that we actually established was the Australian field hospital, which was established by the airport. It had a lot of, the facility had a 30-bed facility with 2 operating rooms. The only problem was the head, Ian Norton, asked me, Dr. Herbosa, do you have nurses? How many do you need? I said, I need about 25. So I sent the 25 nurses because, as you know, the Philippines supplies the world with registered nurses. So I had no problem supplying him. And then when the doctor discovered that it was nicer to operate in the field hospital because it was fully air conditioned, the neurosurgeons and the orthopedic surgeons started doing their operations in the field hospital. The Australians were just having coffee. So this is another view of how strong the storm surge was. This is about 1 kilometer inland. The boat is still there. Actually, they repainted it already. So it's become a monument in the area. These are all the different countries that actually responded. It's good that countries respond. For me, it's bad because everybody wants to be there. Why? Because there is a political tie-up with it. Why do people from Europe want to go across the world to help us? And I was thinking, what is the political reason? Because humanitarian groups in those countries need to perpetuate their existence. There's a budget required for them so that if they don't respond, their budget will be cut. So that's the politics of it. Why shouldn't I just get my neighbor, Malaysia, Indonesia, Singapore, Japan? Why are it that European countries are going? So that's the difficult part of understanding. You will travel 12 hours, and then when you get there, it's no longer the need that we actually want. So that's very important to understand. So that's why the UN and WHO is trying to do this health cluster approach. They're trying to do now, after Typhoon Haiyan, a pre-registration of foreign medical teams so that they can respond similar to what they did in Paris, the right response appropriately for the right intervention or need. So you can see the flag of Malaysia there. One of the first ones that you will see when you land in the airport, you will see the C-130 of Malaysian military and the Mercy Malaysia team that was actually there for the whole many months. So this is a infographic of the things that happened there. Let me just point out what the contributed. For Malaysia, you sent us 3 C-130s, 1 field hospital, and 53 medical personnel with about $1 million in contribution. So this we're very grateful for. Aside from this is the official, and then they also have the non-government agencies. So it's very important to implement research among disaster workers. I'm trying to do this because what's difficult is people tend to tell case stories instead of learn what works and what doesn't work. We need to get away from the social science approach of disaster risk reduction and proceed with very good studies on what really works and what doesn't work. We need to look at innovations. We need to look at technology like the speed information, which really had beneficial outcomes, or the project an early warning system, or the geographic information system for foreign medical teams. These are not reported in the media, but these are great advances that have helped us in terms of responding to a major disaster like Typhoon Haiyan. This is an example of a research framework that we're promoting now. This was developed by Marvin Birwang of the World Association for Disaster and Emergency Medicine. So the idea, the stuff on the left are all the actions that one needs to take. You assess the level of function, you compare the current level of function with the pre-event level of function, you identify the needs, then you do a strategic plan, and you study available interventions, and then you do an operations plan, implementation, assess, monitor that implementation, and then you'll have a new level of function. So this is the idea of how we feel we should be studying disaster medicine. We should be actually putting a correct framework and understanding it piece by piece, not on a very whole and broad aspect, usually becomes a storytelling or a narration. So this is Mercy Malaysia. I think it's one of your strongest groups. They go to Palestine, they go to most of the remote areas. Mercy Malaysia providing outpatient services with their FMT type 1 in the area of Tacloban. Another thing is the framework approach is really very important. If you want, especially I'm addressing now the young people here, if you're interested in disaster, I think what's important is that we shift our methodology by understanding really a framework approach, the same way we would approach cancer research or trauma research. So a lot of the problems in disaster research is the very strict ethical review boards that's been created in many institutions. And we need to deliver services, and yet we need to collect data. So our approach in the Philippines has been to create an army of researchers as well that will collect data and information. So if there is data and it is organized into information. And we can analyze information, and we can create new knowledge out of it. And the new knowledge can be applied to actually save lives. So again, another photo of outpatient clinic being conducted by doctors from Malaysia, Mercy Malaysia. I specifically took out the pictures so that you can understand that a lot of the stuff you do here, although you do not use in Malaysia, you end up using in other countries that you actually assist in the region. So this is the total data of what Typhoon Haiyan. 11.5 million people affected, 2.5 million people in need of food, and about 544,000 people displaced, 130,000 houses totally destroyed, and 1,200 evacuation centers. So we need to build 130,000 houses still for this community, and that has been the debate right now. How fast do you rehabilitate an area that has been damaged by a massive storm? So very important for my message this afternoon. We need to fund research in disaster risk reduction and disaster science. We need to standardize frameworks so that different studies can be compared. And it shouldn't be lessons learned. It should be lessons that have been applied so that we can change the way we do. And we need to have a writing and sharing culture in the field of disaster science. This is us at site at the Eastern Visayas Regional Medical Center. These were our teams that were actually on the ground at that time, organizing response. We have both local and international, doing what we call health cluster meetings every morning. So it's very important to transfer this knowledge and this data research. We change policy based on that, what works and what needs to be done. So we ensure a good governance or leadership framework, and we create levels similar to what we do in controlling IT development, wherein the strategic level at the head of the ministries, they will just evaluate, direct, and monitor. The rest of the agencies must align, plan, organize, build, acquire, and implement, and then deliver the services support. But all of this need to be monitored, evaluated, and reported. And this is my plea to our young people. Again, more pictures of our meeting. Now I end with the priorities of the Sendai framework in Japan. Sendai framework brings in 4 priorities. We must all understand disaster risk. We reduce the risk, we don't manage the disaster. We strengthen disaster risk governance. That's the leadership I'm talking about, to manage disaster risk. And we invest in disaster risk reduction and resilience. How do we build back? So enhance the preparedness and effective response and build back better, so improving resilience, recovery, rehabilitation, and reconstruction. Again, when we apply new things, I'll give you the Gartner hype cycle. When there is something new, there is initial technology trigger, then there is a peak of inflated expectation. This will be followed by a trough of disillusionment, and then a slope of enlightenment, and finally, the plateau of productivity. So I end with the scope, ladies and gentlemen, in the information age, it's about oceans of data flowing into rivers of information collected into lakes of knowledge that provides us droplets of wisdoms. Terima kasih banyak.
Dr. Keroh, I would like to request that you remain on the stage for prayer ceremony. Now, we would like to call upon the stage Professor Dr. Fikri M. Abu Zidan to join Dr. Teodoro for prize giving ceremony. Thank you. Sure.
Lieutenant Yusuf, thank you very much. I think the door is open for discussion. Anyone who want to have any questions to the speakers, please. You can stand behind the phone and give your question, please. Okay, so I can start actually.